Boa tarde, estamos mais um programa podcast da Visão Hospitalar. Hoje estamos com um convidado muito importante, que é a presidente do EHF aqui no Brasil conosco. Vou fazer uma introdução pequena só para vocês saberem o tamanho dessa mulher que está com a gente hoje aqui no programa. Doutora Mora Abdul Razak Tahlak é a diretora executiva do Hospital Latifa, um hospital especializado em maternidade e pediatria com 357 leitos, que faz parte da Autoridade de Saúde de Dubai, Emirados Árabes Unidos. A doutora Tahlak é uma consultora de obstetrícia e ginecologia. Ela também é a primeira mulher emiradense a complementar sua especialização com obstétrica em Hospital John Hopkins. Olha aí o tamanho dessa mulher, John Hopkins, né? E aí ela é certificada pelo Conselho Americano em Obstetrícia e Ginecologia e um membro do Congresso Americano de Obstetrícia e Ginecologia. É uma grande médica doutora, né? A doutora Tahlak é uma palestrante regular em conferências e recebeu vários prêmios por excelência em sua área. Após ser tesoureira do EHF, a doutora Tahlak foi eleita presidente designada do EHF em novembro de 2021. Iniciou seu mandato como presidente da EHF em 2023. Além disso, ela é membro de várias outras sociedades e associações nacionais e internacionais de renome. Welcome, Doctora, with us today here.
Thank you. Thank you for having me.
It's a great pleasure to have you with us in our program today. We want just tell us about your experience with EHF as a leader, as a woman, as a doctor, how you can work to connect all the parts in all the world.
So IHF, International Hospital Federation, is actually a federation of over 90 years. And we are membership-based countries, that are members in IHF. And it's all about hospital management. So hospital associations are members. And Dubai Health Authority is actually one of the member, associations with the IHF. So in 2016, I represented Dubai Health Authority, and this is how I came to know IHF. And continuing through the many years that I have been with IHF, I became the treasurer initially, and then I was, elected as the president designate for 2 years. I am now president of the IHF, and then I have 2 more years to be the immediate past president. It's a wonderful experience. It's amazing because really IHF is a very global, network of organizations and associations. So I get to meet people from around the world. We do have our congresses once a year in different parts of the world. Last year we were in Lisbon. This year we are in Rio, Brazil. And then next year we're going to Geneva. So working with very diverse group is very exciting to me. And I think, having a women leadership, I'm the 3rd female president of IHF. So, it gives that diversity and inclusiveness. And I believe that, we as women really have a lot of talents that we can, add to our colleagues. Men, of course, we complete, each other. But it's the great minds when they come together, being women or men, and serving our communities and health.
Thank you, Doctor. And we see that we have in IHF hospitals from all the world, from Asia, Europe, American, and what's the thing that connects all the hospital in terms of problems or solutions? As a leader and as a president, what's the best thing that you can give for this hospital, like to share information, share problems, share solutions along all this information?
Sure. So what I'm learning more and more is that we have essentially, same problems across the world. Maybe, some differences are always there, but let me tell you examples. Financing healthcare is a big problem everywhere, Yes, we don't have a golden basket. The rise in the healthcare cost, we all know that. And so governments are supporting, but then we also have issues related to that. The other challenge that the whole world is facing after COVID pandemic is that big number of healthcare workforce are leaving.
Yeah.
We have severe shortage, and we know if we don't take actions today, 30 years down the road, it's going to be a big problem. This is everywhere. We have issues with access, patient, having equality, access to care among all our populations equally, without costing them a lot, and many, many, many more. So challenges are same, but the beauty of this big international community is that when they come together, they hear different solutions. A solution that's working in Rio and Brazil that would make, sense to do in Dubai, UAE, for example. Similarly, so this is, I think, the strength that we have today, the strength of collaboration, camaraderie, and really sharing knowledge, experience, and learning from each other.
You mentioned a good important point about COVID. We know that since COVID 2020, the telemedicine was used abundantly all over the world. Here in Brazil, it's a big country, and we cannot democratize the access without using technology. And from your point of view about telemedicine, if you can share with us how telemedicine is applied in Dubai, between private hospitals. I don't know if in Dubai there is also public hospitals, because here in Brazil 75% of the people use the public health to take care. Can you mention some information about Dubai, how they would work with telemedicine in private or public, if there's publics? Excuse me, I don't know a lot about the health.
No, sure. So in Dubai, we also have both public and private.
Yeah.
And our public sector is 30% of the healthcare.
Opposite of us.
Yes, 70% of the healthcare goes to private. But again, I mean, there is differences because, the complex care, the very difficult cases go always to the government. So we have a huge support there. Telemedicine is important. I always say, it's people, process, technology. We have to have the right technology today to help us. In COVID, you mentioned, telehealth was critical because we couldn't reach to patients. Patients couldn't come, And we do have a telemedicine. We're very pro technology, so we do use it both in private and in government sector, reaching out patients for, sometimes patients don't have to come. It could be just solved by communicating.
Teletriage, interpretation.
Yes, exactly. So definitely that's available. Also, I think integration of the care.
Interoperability.
Yes. And today I want to say that we in Dubai have, so in the government sector, we have our own electronic health record, the whole data about the patient.
It's for public and private people.
Yeah.
Yes.
So, and private has different modalities, but that's all now connected. Also, if a patient goes to the public hospital, they can see everything that patient is done. Yes.
Right.
And this access really helps a lot. So there is no duplication, efficiency of the services, and really, doing what patient needs best for
save people. When data are connected, now you can even you can use telemedicine as to complete the journey of the patients in health.
Yes,
because I believe that telemedicine comes to not as just something isolated. It has to complete the traces of the patients, and this interoperability, the connection between system is important. Also, to have secure connections because of the data.
Yes,
private data are very important. Then I see all about what saying you talk about cost, how cost is important in the health systems, and we see that more people need the health systems. Cost is always going high, and how can you deal in terms of health insurance, because health insurance have its legacy to control everything. This connection between hospital and health insurance, how you can say about deliver medicine of value instead of medicine of cost.
Right.
I want to just share your opinion about this medicine of value.
True. So yes, I think, we hear about value care, and we need to move away from fee for service to really what value are we adding. And actually, I think it's a very innovative market. Today we heard in one of the sessions financial sustainability, and the speaker was actually from an insurance company, Bupa, which is an insurance company in UK, one of the big payers. And they showed us some innovative solutions where they were really adding value to the patients than just being, the payer who could say, no, we don't pay for this. I think one important key issue is that we need to concentrate on prevention and not just cure, Insurance markets, unfortunately, known for more just treating acute, care, but we need to shift that. And we saw that in the model that Bupa was showing today. So I think this is the beauty of coming to these, congresses and learning what other countries and payers, providers, all doing to serve the patient.
It's not easy to deal with the value of care analysis.
And you'd be interested to know that they are saving money by doing actually that.
Because when you care about the value of care, you are saving money, but you have to be and manage all the costs. Few hospitals know that is a great value for the patient and also for the hospitals. And also that the system cannot collapse because of the cost. Doctor, I will thank you again to have you here in Brazil with us in Rio de Janeiro. It was a great factor to have you here. And we want to hear from you the final message for the Brazilian people, for the health system in Brazil, and for the world.
Well, first, let me thank you for having me today here. It's been a wonderful trip to come and see Brazil, and, meet the people from Brazil. You have a wonderful system. I think every system, we heard the challenges, but you have great opportunities that, the whole world can learn from. The Brazilian Hospital Federation is an amazing federation that's been doing great job with hospital associations, with thousands of hospitals, members in this. So I really congratulate you on what you have, and I wish you all the best and the prosperity in the coming future.
Quero agradecer a todos pela participação no nosso podcast Visão Hospitalar, junto com a doutora Mona, presidente de EHF aqui no Brasil, onde eu e a Mona trocamos a visão dela, a estratégia do saúde do Brasil, do mundo inteiro e Dubai. Interessante que a doutora Mona abordou os assuntos que a gente realmente também temos problema aqui no Brasil, que a parte de interoperabilidade, a parte de telemedicina, a parte de entregar de medicina de valor para a população como todo, É algo muito interessante que ela comentou que em Dubai 30% usa hospitais públicos, 70% usa os privados. Praticamente contrário ao Brasil, que 75% são SUS e 25% privada. Mas foi uma entrevista rica de informações entre nós. Agradecemos todos ao GISA, FBH pela participação nesse evento. E vamos agora para o segundo evento, ano que vem, vai ser em Genoa.
Muito obrigada. Shukran jazilan. Thank you.